First of all, I would like to say thanks to my respected sir because he has given me a golden opportunity to say something about this topic, and the topic is government hospitals are far better than private hospitals. But I disagree this topic, and today I want to clear this topic, like saying something about saying some advantages of private hospitals and saying some disadvantages of government hospitals. I just want to clear it today. So first of all, I would like to start from advantages of private hospitals. When we see private hospitals, so what do we see? We see that the facilities are all the facilities are available there. All doctors are available there, all instruments are available there. When we see the situation of a private hospital, so we see that many people are going there and many rich people are also going there. So this because of why? Because there are a lot of instruments, there are a lot of doctors, and many things are there. Even everything in a private hospital. So even when we see that who has made the government hospital, they also go to private hospital when they need to go. They don't go to government hospital. It is also advantage of a private hospital that they choose a private hospital for their treatment. So they have asked many questions to me, and I would like to answer those questions. That they all were saying that there are most of the doctors they want to join a government hospital, but the reality is something else. They haven't searched it. Just common sense is different, but you need to search something. If every 10 doctors, in every 10 doctors there are 9 doctors they want to join a private hospital. The reality is totally different. And the second thing, facilities. What type of facilities are you all talking about? The facilities are, there are no beds, there are no limited beds, there are no instruments. Even some of the hospitals are like doctors are bringing instruments from their house. This is the condition of a government hospital. Show me a single private hospital, their condition is different. Even if we see the majority, you all are talking about that there are 2 good hospitals, but see that how many government hospitals are good. See the ratio, see the majority. You all are saying that some colleges are good, some hospitals are good. It doesn't matter that some colleges or some hospitals are good. We need to see the ratio, we need to see the majority. The majority is that the private hospitals are far better, and too many private hospitals are everywhere. Okay, the difference is here. And another thing, she was talking about medicines. You know, generic medicines or branded medicines. Generic medicines, doctors doesn't write the generic medicines because their cost is too less. Government doesn't allow to write generic medicines, and there is no difference between generic and branded medicine. The difference is only of cost. But they all are talking about that private hospital doctor writes something, they give some types of medicines. Then why don't you study? You should become an educated person. Here that they loot, it doesn't matter. Why are you not studying? Why don't you teach your brother or your sister? When sir was telling us his own story, that what happened, so sir was educated there, that's why sir was able to handle that. So we all need to become an educated person. No need to allege that we will allege those doctors they are writing something else. So why don't you study? The moral of the story that education matters. Second thing, a story. How many types of story do you want to listen? I have many stories. You are saying this happened there, that happened there. If I make you listen, you won't be able to listen at least. There, MGM hospital. Let's talk about MGM hospital, and we will talk about after some government hospital. Before some day, there was a lady. She took her brother to the MGM hospital, and there doctors were saying that write something, write here, talk to him, talk to them, and just in writing the brother got died. Just in writing, this happened in MGM hospital. This was the situation. And just before some day ago, the boy who was cut by a snake. And when they took the boy to the government hospital, to MGM hospital, there were no doctor for treating that boy. That's another thing. And one in Bihar hospital, there was a situation. Even in government hospital, they were doing jhad-phuk in government hospital. I have the English word, but Exorcism, yes. They were doing exorcism in government hospital. This is the condition of government hospital. You all are just talking about those hospitals which are good, but the majority is totally different. Even I told you the majority as well, that every 10 doctors there are 9 doctors who wants to join a private hospital. Second thing, qualification. Mr. Akif was talking about qualification. There are too many qualified doctors, but the reality is that there are doctors are not available in government hospital. This is the reality. Doctors are not available. She said that for every 1,000 patients there is one doctor in a government hospital, and in private hospital for every 3 patients there is a doctor. This is the difference between private and government hospital.